metrics that you use, or what are the metrics that you use to determine attractiveness to a nose?
That's an interesting question. You know, there are two components to doing any plastic surgery procedure, and pretty much anything you do in surgery. There is the technical aspect of what you're doing, and there's the aesthetic judgment that goes into how you want it to come out. The aesthetic judgment can be learned to a degree, but it's very interesting if you see people who you know are very bright physicists or whatever, and you notice they're putting the wrong tie with the wrong shirt. Even though they're bright and talented and have great technique in what they do, their aesthetic judgment is not always on a par with their professional capability. So what do I mean by that? Well, you can learn the motions of doing an operation, but if you don't know what looks good, it's very hard for you to create something that's attractive. So that's an important component. Most people seek rhinoplasty to improve either the tip of their nose, which they figure is too big or broad, or they have a bump on their nose, or their tip is drooping a little bit, or their nose is too broad. But whatever aspect of the nose that you go to change, it affects all of the other ones. So it's an interrelated, stepwise operation that has to be integrated, and you have to know where you're going to go from the start and be able to adjust the other components as you're achieving your final result.